Welcome to Module 4 Eligibility Factors. This presentation will cover the following topics: Washington State Residency, Social Security numbers, Citizenship and Immigration status, and resources. Washington State Residency. A Washington resident is someone who currently lives in Washington State and intends to continue living in Washington permanently or for an open-ended period of time, entered the state looking for a job, or entered the state with a job commitment. Apple Health programs are limited to Washington residents. Please see WAC 182-503-0525 for information on residency criteria for individuals residing in an institution. In addition to the previous slide, for children aged 18 or younger, residency follows their parent or caretaker unless they are 13 or older and can attest to their own residency. An individual can be temporarily out of state for more than 1 month and still be considered a resident if they intend to return to the state once the purpose for their absence has been accomplished and are not determined eligible for Medicaid in another state. Persons visiting Washington are not considered residents of Washington. Example of those who are not residents include individuals from out of state who are attending college in Washington and intend to return home after completing school, or who entered Washington without a job commitment, are not looking for work, and do not intend to stay. Another example of an individual who is not a Washington resident is a temporary visa holder. Generally, a temporary visa holder is not a Washington state resident unless they intend to reside in Washington after their visa expires, entered the state with a job commitment, or entered the state looking for a job. Please note, meeting the residency requirements does not make temporary visa holders automatically eligible for Apple Health. Individuals must meet all necessary eligibility components to be eligible for coverage. An individual who enters Washington State only for health care is not a resident and is not eligible for any medical program, except for individuals who move directly into a Washington nursing facility. Now, we will apply this information to several scenarios. Scenario 1. Lisa enters the U.S. from overseas with a tourist visa. Lisa gives birth to Henry, and both return home after a 2-week stay. Are Lisa and Henry Washington residents? No. Neither Lisa or Henry are considered residents because they are only visiting. Scenario 2. Mary is receiving Apple Health coverage and must take care of her ill grandmother who lives in another state. Mary expects to be gone for several months. Is Mary still a Washington state resident? Yes. Mary is still a resident of Washington because her absence is temporary and she will return to Washington. Scenario 3. The Smith family came to Washington State from Montana for cancer treatment at a local children's hospital and plans to return as soon as their child completes treatment. The family will be here for a minimum of 6 months and could possibly be longer depending on the progress of the treatment. Are the Smiths Washington residents? No. Since the family entered the state for medical care and they plan to return home, they are not considered residents of Washington. Scenario 4. Justin and Brittany are in the U.S. on student visas, attending college, and have Allie, their U.S.-born child, age 2. The parents apply for Apple Health. When asked, Justin and Brittany declared they intend to return to their home country with Allie when they finish with school. Are they Washington residents? No. Since Justin and Brittany do not intend to live in Washington indefinitely, the family is not considered residents. Social Security number. A valid Social Security number, or proof that an individual has submitted an application for a Social Security number, is required for all Apple Health programs except for Apple Health for Refugees, Apple Health Alien Emergency Medical, Apple Health for pregnant women and children who do not meet citizenship criteria described in WAC 182-503-0535, and Apple Health for newborns if the birth parent was receiving Apple Health on the date of delivery, including through a retroactive eligibility determination. Please note that household members who are not applying do not have to provide their Social Security number. When an individual is unable to provide their Social Security number, either because it is not known or it has not been issued, they must provide proof from the Social Security Administration that an application for a Social Security number has been submitted and the Social Security number when it is received. Apple Health is not denied or terminated while waiting for the Social Security Administration to send a Social Security number. Individuals who are required to provide a Social Security number or proof of the Social Security application but refuse to do so will not receive Apple Health coverage except if they are not able to obtain or provide a Social Security number because they are a victim of domestic violence, are not eligible to receive a Social Security number, or may only be issued a Social Security number for a valid non-work reason, or refuse to apply for or provide a Social Security number for well-established religion objections. Citizenship and Immigration. All Apple Health applicants must provide their citizenship immigration status, which determines what program an applicant is eligible for. Individuals fall into one of the following groups: U.S. citizens, U.S. nationals, qualifying American Indian born abroad, lawfully present qualified non-citizens, lawfully present non-qualified non-citizens, and immigrants who are not lawfully present. Let's review the different citizenship and immigration groups. Who are U.S. citizens? U.S. citizens are individuals born in the U.S. or its territories, Guam, Puerto Rico, the U.S. Virgin Islands, and residents of the Northern Mariana Islands who chose to become U.S. citizens, individuals who have become naturalized U.S. citizens, and certain individuals born abroad to at least one U.S. citizen. Who are U.S. nationals? U.S. nationals are individuals born in American Samoa or Swains Island and residents of the Northern Mariana Islands who did not choose to become U.S. citizens. Who are qualifying American Indians born abroad? Qualifying American Indians born abroad are individuals born in Canada and have at least 50% American Indian blood, regardless of tribal membership, or individuals born outside of the U.S. and is a member of a federally recognized tribe or an Alaska Native enrolled by the Secretary of the Interior under the Alaska Native Claims Settlement Act. Who are qualified non-citizens? They are individuals who are lawfully present in the U.S. and must meet or is exempt from the 5-year bar. The 5-year bar is a restriction that prohibits qualified non-citizens from receiving federal benefits during their first 5 years of their qualified immigrant status unless they meet one of the exemption rules or have continuously lived in the U.S. since prior to August 22, 1996. Who are qualified non-citizens? They are individuals who are lawfully present in the U.S. whose status is not included in the qualified non-citizen category. Who are immigrants who are not lawfully present? They are individuals who entered the U.S. without document inspection or who entered the U.S. lawfully but whose status has expired or been revoked by United States Citizenship and Immigration Services. This table shows different citizenship and immigration status and their potential eligibility. For more detailed information on this subject, click the link showing in this slide. In the next slides, we will review in more detail the qualified and non-qualified immigrant statuses. The 5-year bar applies to the following individuals: lawful permanent residents, parolees granted parole for at least 1 year, abused spouses with children with an I-130 notice of prima facie approval or a pending approved self-petition under the Violence Against Women Act, admitted to the U.S. as a conditional entrant prior to April 1st, 1980. Please note that the 5-year bar does not apply to individuals who have obtained a qualified alien status within the last 5 years. If they entered the U.S. prior to August 8, 1996, and have continuously lived in the U.S. since prior to August 22, 1996. Pregnant women and children do not have to meet the 5-year bar and can receive medical coverage with no wait period if all other eligibility requirements are met. A lawfully present qualified non-citizen is exempt from the 5-year bar if they are admitted to the U.S. as a refugee, granted asylum, granted withholding of deportation or removal, a Cuban or Haitian national who was paroled into the U.S. or given other special status, and a Mara-Asian child of a U.S. citizen under 8 CFR Section 204.4. Also exempt from the 5-year bar are individuals from Iraq or Afghanistan who have been granted special immigrant status, certified or approved as a victim of trafficking by the Federal Office of Refugee Settlement, or if they are family, who are armed service members, veterans, or family members who are lawfully permanent residents, parolee or abused person, who are Hmong or Highland Laotian tribe members born before May 8, 1975, whose tribe assisted the U.S. military during the Vietnam era, and their spouse and unmarried dependent children age 18 or younger. Now, let's review non-qualified immigrants. Lawfully present non-qualified non-citizens include but are not limited to citizens of Marshall Islands, Micronesia, or Palau, business visitors, students, and tourists entering the U.S. for limited time for a specific purpose, immigrants paroled into the U.S. for less than 1 year, fiancé of a citizen, applicants for adjustment of status, asylum, cancellation of removal, suspension of deportation, or withholding of deportation or removal. Lawfully present non-qualified non-citizens also include K, S, U, or V status visa holders who are allowed to work and eventually adjust their status to lawful permanent resident, immigrants paroled into the U.S. for less than 1 year, cancellation of removal, suspension of deportation granted or deferred action, with the exception of deferred action for childhood arrivals. Individuals granted DACA status are not eligible for federally funded Apple Health programs or eligible to purchase health care coverage through a qualified health plan. health insurance premium tax credit. They are potentially eligible for the following programs: state-funded Apple Health for Kids and Pregnant Women, Alien Emergency Medical, and Medical Care Services. Individuals who enter the U.S. and are not lawfully present or entered legally, but their lawful presence status has expired, could qualify for some Apple Health Medicaid programs. Resources. For more resources and training materials regarding Apple Health Medicaid and the use of Health Plan Finder, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications in Health Plan Finder. These representatives serve specific counties. For more information about the Washington Health Benefit Exchange, you can visit www.wahbexchange.org. Congratulations! You have completed Module 4 of the HCA Community-Based Training. Please continue on to Module 5 of the 7-module HCA Community-Based Training.